So thinking about heart disease, we're just going to talk first and remind ourselves that heart disease is a major concern that we are preoccupied with, thinking about how nutrition may mitigate the risk. Heart disease is the second leading cause of death in Canada. It's the leading cause of death in Mexico. And we know that there's many risk factors for heart disease. A lot we can't control, but a lot we can do things about it. And diet is a huge one. So here we're talking about wheat today. And we know that wheat-based foods can be a source of many nutritional components that could benefit heart health. So we know whole grains, dietary fiber, resistant starch, B vitamins, all of these are studied in the literature as components of wheat-based foods that can benefit heart health. And so here I wanted to include this research study as our research spotlight for heart health. There are so many studies that have been done. You know that when meta-analyses are done, this is an indicator of consistency of evidence. And here, this particular study was a large meta-analysis combining all of these studies. So there was 45 cohort following people over time, 21 clinical intervening that examined, specifically focused in on whole grains. And a lot of these were wheat-based food studies, and looking at diabetes as well as heart disease. So these studies are pretty large. The cohort studies up to 90,000 people followed for 26 years, and the clinical studies up to 200 people intervening for up to 3 months. And overall, these results combined together showed that 3 to 5 daily servings of whole grains significantly was related to reduced risk of diabetes and heart disease by up to 25%. And as well, less weight gain over a 13-year period. So this is a really core evidence-based study to show that whole grains can reduce the risk of heart disease and diabetes. And wheat-based foods definitely are a source of whole grains. And so this is a good research spotlight to include in this topic.